The Oxford AstraZeneca vaccine is one of several that has been shown to be effective in preventing severe disease, hospitalization, and death from COVID-19. The emergence of new variants of the virus has raised questions about the potential impact of those variants on vaccines. Yesterday, South Africa announced that it was putting a temporary hold on the rollout of the Oxford AstraZeneca vaccine after a study showed it was minimally effective at preventing mild to moderate disease caused by a variant first identified in South Africa. This is clearly concerning news. However, there are some important caveats. Given the limited sample size of the trial and the younger, healthier profile of the participants, it's important to determine whether or not the vaccine remains effective in preventing more severe illness. These results are a reminder that we need to do everything we can to reduce circulation of the virus with proven public health measures. Several countries are succeeding in suppressing transmission, including those where new variants are circulating. We all have a role to play in protecting vaccines. Every time you decide to stay at home, to avoid crowds, to wear a mask or to clean your hands, you're denying the virus the opportunity to spread and the opportunity to change in ways that could make vaccines less effective. It also seems increasingly clear that manufacturers will have to adjust to the evolution of the virus, taking into account the latest variants for future shots, including boosters. We know viruses mutate, and we know we have to be ready to adapt vaccines so they remain effective. This is what happens with flu vaccines, which are updated twice a year to match the dominant strains. WHO has an existing mechanism for tracking and evaluating variants of the virus that causes COVID-19. It's vital that countries continue to report these variants to WHO so we can coordinate global efforts to monitor their impact and advise countries accordingly. We are now expanding that mechanism to provide guidance to manufacturers and countries on changes that may be needed for vaccines. These developments highlight why it's so important to scale up manufacturing and roll out vaccines as quickly as possible and as widely as possible to protect people before they're exposed to new variants. We also need to continue designing and conducting new trials, and we need to keep a close eye on the impact vaccines are having on epidemiology, severe disease, and death, so we can use vaccines to maximum effect. WHO Strategic Advisory Group of Experts on Immunization, or SAGE, has met today to review the Oxford AstraZeneca vaccine and to discuss these new developments. Tomorrow, I will meet with the chair of the SAGE to discuss its recommendations.